Maya sleeps 8 hours this month and still wakes wrecked, so her partner hears snoring stop before one sharp gasp. By breakfast, her brain feels wrapped in wet cotton and she snaps at a shoelace before work even starts. The scary part is that she remembers none of it because her body handles the crisis while she thinks she slept. At the back of the throat, soft tissue collapses inward and the airway narrows until air cannot pass. So oxygen drops and the sleeping body triggers alarm signals, which jolts her halfway awake just enough to breathe. Doctors call this obstructive sleep apnea, which means sleep keeps breaking because breathing keeps getting blocked. It can happen dozens of times each hour, and an estimated 1 billion people live with it. Most never get the name, so they blame stress or age, but every choke pulls oxygen down for a few seconds. The body releases stress hormones, so the heart gets pushed. Over years, those surges can raise blood pressure. The same nights can strain the heart and metabolism. So Maya calls herself a bad sleeper, while her partner has been hearing a medical clue for years. For decades, the main tool was CPAP, a mask machine, which pushes air through the nose to hold the airway open. It works for people who can sleep with it, but many pull it off and quietly give up. Surgery exists, but that is a bigger step for selected cases. So the ordinary story used to end with a mask, and if the mask failed, the toolbox felt brutally small. But this month's paper breaks the old instinct, because sleep apnea is more than a floppy airway problem. The airway opening muscles also lose tone during sleep, so researchers treated the airway as a muscle control problem. On May 18, 2026, Apnimed published SynAIRgy in AJRCCM. Phase 3 tested a once-nightly pill called AD109 using eroxybutynin with atomoxetine to raise airway muscle tone. 646 adults entered, and care teams ran visits across 69 centers in the United States and Canada. After 6 months, breathing interruptions fell by 55.6%. Placebo fell by 19.1%, which kept the comparison honest. Nearly 40% cut their interruptions by at least half, and about 22% reached the disease-controlled range. Oxygen starve time fell about 60%, which is the human payoff. The common side effects were dry mouth, insomnia, and nausea, and researchers tied no serious drug-related harm to the pill. Study chair Patrick Strollo said the results point to muscle control, which matters because it explains how a pill could help. But the straight talk is simple. This is still investigational. The FDA has the filing, with a decision expected around early 2027. So it is not a blanket mask replacement today. It was studied in people who refused or could not tolerate the mask. That means the first use is narrower than headline sound. For Maya, the useful part starts before any pill. Loud snoring plus daytime exhaustion gives a clinician something testable because a sleep test can catch the choking your memory misses. Treatment can make nights steadier, and the toolkit may soon widen, so when a full night still leaves you wrecked, that test can name it. If this was helpful, like and subscribe to Alokick Health for more such informational content.